What we did in a study is we looked at two different cohorts of patients, and these patients were estrogen receptor positive early stage patients, but in particular patients with clinically low risk breast cancer. So these are patients with T1 and 0 disease. And what we wanted to do is see if a genomic test, the breast cancer index or BCI, would be able to stratify these patients based on their risk of late recurrence. And we know this is an important issue, particularly given the findings of the NSABP B42 and some of the other trials presented on Wednesday that showed that only a very small proportion, and actually in these studies they were a non-significant proportion of patients benefited from extended endocrine therapy or 5 more years of endocrine therapy. And so in our study, we stratified these patients based on the breast cancer index biomarker, and what we found was that even in these clinically low-risk patients, the BCI test identified about 30% of those as being high risk of late recurrence, and those patients had a significantly elevated risk of recurrence compared to the BCI low-risk patients. And so even though these are clinically low-risk, small tumors, node negative, they may actually be these bad actors that are more likely to have a late recurrence and therefore may be more likely to benefit from extended endocrine therapy.